Welcome to Study Nurse IQ's NCLEX and ATI style practice quiz. Today we'll cover 30 questions on pharmacology concepts on role of RN versus NP versus MD roles in prescribing, controlled substances and safe med admin, legal prescribing guidelines, and real-world NGN clinical scenarios. Let's begin. Let's take a brief moment to prepare ourselves for focused learning. A patient is prescribed an oral medication that must be taken on an empty stomach. The nurse understands that this instruction is likely due to which of the following? Take a moment to consider your options. Take a moment to think about your answer. The correct answer is B, to avoid drug-food interactions that may decrease absorption. Taking a drug on an empty stomach prevents food from interfering with absorption. Let's pause briefly to let this concept sink in. Which of the following factors can affect the absorption of a drug from the gastrointestinal tract? Select all that apply. The correct answers are A, C, and D. Gastrointestinal motility, drug formulation, and gastric pH can all affect drug absorption. The first pass effect is a form of metabolism, not absorption. The fraction of an administered dose of a drug that reaches the systemic circulation is known as what? The answer is bioavailability. Bioavailability is the fraction of an administered dose of a drug that reaches the systemic circulation unchanged. A nurse is explaining the process of drug absorption and distribution after oral administration. Place the following steps in the correct order. Take a moment to arrange these steps in the correct sequence. The correct order is 1. The drug is swallowed. 2. The drug is absorbed into the bloodstream. 3. The drug is metabolized in the liver. 4. The drug is distributed to target tissues. A nurse is explaining the first pass effect to a student nurse. Click on the organ in the image where the first pass effect primarily occurs. Take a moment to identify the correct organ. The correct answer is the liver. The first pass effect occurs in the liver before the drug reaches systemic circulation. A patient is prescribed a highly protein-bound medication. The nurse should be concerned about the increased risk of drug toxicity in a patient with which of the following conditions? Take a moment to consider which condition would affect protein binding. The correct answer is B, hypoalbuminemia. A highly protein-bound drug will have significant binding to plasma proteins, primarily albumin. Low albumin levels increase the risk of toxicity. Which of the following factors can influence the distribution of a drug throughout the body? Select all that apply. Take a moment to identify all relevant factors. The correct answers are A, B, C, D. Drugs' lipid solubility, protein binding, blood flow to tissues, and molecular size can all affect distribution. A drug that is highly lipid soluble will be more likely to cross the blood-brain barrier and affect the central nervous system. Take a moment to recall this important barrier. The answer is blood-brain barrier. The blood-brain barrier is composed of lipid layers that protect the brain. Highly lipid-soluble drugs can more easily cross this barrier. A drug is administered intravenously. Place the following body parts in the order in which the drug will likely be distributed, from fastest to slowest. The correct order is 1. Kidney, 2. Brain, 3. Skeletal muscle, 4. Fat tissue. Distribution is based on blood flow, with highly perfused organs receiving the drug first. A nurse is showing a patient a graph of how their medication will build up in their system. Click on the 2 organs that receive the highest blood flow. Take a moment to study the graph. The correct answers are brain and kidneys. These organs receive the highest blood flow and will therefore receive the drug most rapidly after it enters the bloodstream. Great job! You just completed the first set of NCLEX and ATI style questions with Study Nurse IQ. Let's move to the second sets of questions. A patient is prescribed an oral medication that must be taken on an empty stomach. The nurse needs to understand why this instruction is important. Which of the following is the most likely reason for this requirement? Let's pause for a moment to consider this. The correct answer is B, to avoid drug-food interactions that may decrease absorption. When certain medications are taken with food, they can bind to food particles, which significantly reduces their absorption and effectiveness. Taking these medications on an empty stomach ensures optimal drug absorption and therapeutic effect. Let's consider the factors that can affect drug absorption from the gastrointestinal tract. Which of the following factors influence this process? Select all that apply. Take a moment to think about each factor. The correct answers are A, C, and D. Gastrointestinal motility, drug formulation, and gastric pH. These factors directly impact how well a drug is absorbed in the GI tract. It's important to note that the first pass effect, while important in drug processing, relates to metabolism in the liver rather than initial absorption. Moving on to our next question about pharmacokinetics. What term describes the fraction of an administered dose of a drug that reaches the systemic circulation? Let's pause briefly to recall this term. The correct answer is A, bioavailability. This is a fundamental concept in pharmacokinetics, referring to the portion of an administered drug dose that reaches systemic circulation in its unchanged form. Understanding bioavailability is crucial as it directly impacts the drug's therapeutic effectiveness. Let's test your understanding of the drug absorption and distribution process. Can you place these steps in the correct order following oral administration? The correct sequence is: first, the drug is swallowed; second, it's absorbed into the bloodstream; third, it's metabolized in the liver; and finally, it's distributed to target tissues. This order reflects the natural physiological progression of drug processing in the body. Now, let's focus on the first pass effect. Where does this important pharmacological process primarily occur? The correct answer is C, the liver. The first pass effect is a crucial concept in pharmacology, where drugs are metabolized in the liver before reaching systemic circulation. This process can significantly impact the bioavailability of orally administered medications. Consider this scenario. A patient is prescribed a highly protein-bound medication. Which condition should raise concerns about potential drug toxicity? The correct answer is B, hypoalbuminemia. When albumin levels are low, there are fewer proteins available for drug binding. This results in higher levels of free drug in the circulation, which can lead to toxicity since more of the drug is available to act on target tissues. Let's examine the factors that influence how drugs are distributed throughout the body. Which of these factors play a role in drug distribution? All of the options are correct. Drug distribution is influenced by lipid solubility, which affects how well drugs can penetrate membranes; protein binding, which impacts drug transport; blood flow, which determines delivery to tissues; and molecular size, which affects passage through various barriers. A nurse is monitoring the patient for signs of drug toxicity. Which of the following findings would be most indicative of an adverse drug event due to the patient's renal insufficiency? Select all that apply. A, increased level of consciousness; B, decreased respiratory rate; C, elevated blood pressure; D, pinpoint pupils; E, decreased urine output. Rationale: a narcotic analgesic will cause central nervous system and respiratory depression if it accumulates to toxic levels. This would manifest as a decreased respiratory rate and pinpoint pupils. The patient's renal insufficiency is causing the drug accumulation, so decreased urine output would be an expected finding associated with his renal issue. Elevated blood pressure and an increased level of consciousness are not typical signs of narcotic toxicity. Through which route are most drugs eliminated from the body? The correct answer is A, renal excretion. The kidneys are the primary route for drug elimination, handling both unchanged drugs and their metabolites through processes of filtration and secretion. Let's discuss an important pharmacokinetic concept. What term describes the time required for blood drug concentration to decrease by half? The correct answer is A, half-life. The half-life is the time it takes for 50% of the drug to be eliminated. This concept is crucial for determining appropriate dosing intervals and understanding how long a drug's effects will last. The half-life helps healthcare providers plan dosing schedules effectively. When one medication affects how another drug is absorbed, what type of interaction is occurring? The correct answer is A, pharmacokinetic interaction. This type of interaction occurs when one drug affects the absorption, distribution, metabolism, or excretion of another drug, potentially altering its effectiveness or safety profile. A nurse is providing education on a drug that acts as a receptor agonist. The nurse correctly explains that an agonist drug will have which of the following effects? A. It will bind to a receptor and block the action of another drug. B. It will bind to a receptor and cause a response. C. It will cause a response without binding to a receptor. D. It will bind to a receptor but will not cause a response. Answer B. It will bind to a receptor and cause a response. Rationale. A receptor agonist is defined as a drug that binds to a receptor and causes a biological response. An antagonist is a drug that binds to a receptor but does not cause a response. It blocks the action of other drugs. A nurse is explaining the process of drug-receptor interaction. Place the following steps in the new correct order, from the drug being administered to the cellular response. 1. The drug binds to its receptor. 2. The drug is administered and enters the bloodstream. 3. A cellular response is initiated. 4. The drug is distributed to the target tissue. Answer. 1. The drug is administered and enters the bloodstream. 2. The drug is distributed to the target tissue. 3. The drug binds to its receptor. 4. A cellular response is initiated. Rationale. The correct sequence of events is the drug being administered, then distributed to the target tissues where the receptors are located, followed by the drug binding to the receptor, which then initiates a cellular response. A nurse is administering a drug that has a half-life of 8 hours. The nurse understands that after 16 hours, what percentage of the drug will have been eliminated from the body, assuming a starting dose of 100%. A. 50%, C. 87.5%. 75%. Rationale. The half-life is the time it takes for 50% of the drug to be eliminated. After the first half-life, 8 hours, 50% remains. After the second half-life, 16 hours, 50% of the remaining 50% is eliminated 25%, so 75% of the original dose has been eliminated. A drug reaches when the rate of drug administration equals the rate of drug elimination. Answer. Steady state. Rationale. Steady state is defined as the point at which the rate of drug administration is equal to the rate of drug elimination. Thank you for completing this pharmacology practice quiz. Remember that understanding these concepts is crucial for safe medication administration and patient care. Keep practicing and reviewing these important principles to build your confidence and competence in pharmacology.